Hi, my name is Jeff Fisher. I've been a chiropractor for 33 years now, almost 34 years, and I've been practicing in the Irvine area for almost my entire career. I actually grew up in Irvine. But I want to talk to you about something very interesting and special that most people don't know, that chiropractors like myself, we can actually treat and help people who have problems with TMJ, okay? And I've been, like I said, I've been practicing a long time. I've seen probably hundreds of TMJ patients now over my 33-year career. And I had a special opportunity before I graduated from school. I had a research project on TMJ treatments, and this is a long time ago. But since then, I've been developing my own techniques and finding really incredible success at treating patients with jaw TMJ problems. And they've tried all different types of therapies, and even were at the point where they were told that they needed surgery. And thank God they were able to come to me before that happened, and I was able to prevent them from having surgery and some of these more extremely invasive treatments. So I wanted to take some time to explain, my perspective and my philosophy at treating TMJ, which is very different from your the medical model and the dental and orthodontic surgeon model of treating this pretty common problem. Many people do suffer from temporomandibular joint problems. It's even called the temporal mandibular joint, but I'm going to go into that a little bit more in depth. Anyways, so to start, I wanted to explain maybe a little bit about what the TMJ joint is. And I've got this great model that's very detailed that shows a lot of the structure and function and all the components to the temporal mandibular joint. And if I take this muscle off the side here and I get a little bit closer, you can actually see this is where the jaw, comes in contact with the head, okay? And this is the mandible down here, and this is the temporal bone, and there's actually a little disc in between. This is the only other place in the human body that there is a disc other than the intervertebral discs in the spine. But there's a disc on each side of our jaw where it helps join the bones together. And so basically, simple explanation of this is, and you can see how it allows motion like a hinge for the most part, and see the muscles are kind of falling off. But I'll get back to this model too. But to begin with, what I want to explain so you can understand yourself is that the temporomandibular joint, and a joint is basically just two bones coming together, like our elbow. Elbow is a joint where two bones come together and allow for motion. Our fingers, we have joints, and like a joint or joining of two structures, two bones together, and that joint allows motion. And in the joint, we typically have cartilage, which like in the TMJ joint, we have the little discs, but in our joints of our knees and our shoulders and our elbows and our fingers, we have cartilage in there. And there's, in some joints, larger joints, there's fluid, like in our knees and our elbows and the joints of our fingers, because they have a capsule that surrounds it, and that fluid allows for lubrication and motion. Well, in the TMJ joint, it's a disc, and that disc is like a soft, cushiony, buffer or shock absorber that allows the jaw to hinge off of it. And there's 2 points that actually attach to the bottom part of the bone that allow for the motion. I'm dropping all the muscles here, but it allows that hinge and the motion. And the problem with the disc in our jaw is like the disc in our spine, is that it acquires lubrication or water content by motion, okay? So a key component to our TMJ joint is motion, and joints live and thrive off of motion. You'll hear this saying, I use this all the time in my practice: motion is life and life is motion. And especially when it comes to the human body, we were designed to move. But we were designed to move in the proper direction and the correct direction, how we're structurally created. And when we move out of that normal or correct motion, that's when we get dysfunction or problems, okay? So again, TMJ, the joint itself, is just like a hinge that allows our jaw to open and close and move, okay? And the unique thing about our jaw is that it's what I consider to be a hanging joint, in that it hangs. So gravity affects it, okay? So even, the positioning of our head, if our head's forward, you'll see some people, their jaw kind of stays open. So the actual curve of the neck and the positioning and how you are from day to day can affect how your jaw is aligned. And of course, talking and eating and chewing. And if you're get an uppercut or a cross or a hook, trauma to the jaw. Or you see people resting their hands and sitting in the thinking position where it's putting that pressure on the jaw. That can affect it. Also, too, I do work with a lot of dentists and dental hygienists, because I get patients referred to me for their TMJ issues. Sleeping on your face. And when you sleep on your face, it can move your jaw. And of course, while you're sleeping, you're relaxed, so the muscles relax. But if you're pushing against your jaw by sleeping on your face all the time, every night, that can affect the positioning and the motion of the jaw, okay? And like all joints, the position, the proper position and the proper motion are super, super important. And the hydration of the joint is super, super important, okay? So hopefully that gives you a little bit better understanding of what that TMJ area actually is, okay? So now what I want to get into is the actual TMJ syndrome or dysfunction or disorder. And those are the 3 most typical terms used to describe when someone's having a problem with their jaw and it's not functioning properly, or it's giving them symptoms. It's giving them pain or dysfunction. They can't chew, they can't eat, they can't open their mouth, their jaw locks out, okay? So there's a big difference between the cause and the symptoms. And of course, you probably know symptoms are the byproduct. They're just a signal. They're an indicator, like a stop sign or a sign when you're driving your car and it says, hey, slow down, curve ahead. They're a warning signal that something is not working properly. Pain is not just a diagnosis by itself, because pain doesn't tell you what's wrong. It just tells you that something is wrong. And also, too, the magnitude of pain doesn't really tell you how bad something is. Pain is really determined upon your own tolerance to pain. And of course, women who have babies, they have a high tolerance for pain. Us guys, even though we have the tendency to suck it up longer, but when it comes to pain, we can't handle as much pain as women can because we're not designed to have babies. So the magnitude of pain is different for each individual, and your tolerance to pain is different, and each condition can cause different levels of pain. So pain by itself is not an indicator of how bad your problem is. Unfortunately, there's people walking around the planet who have cancer. They have really bad problems, and they may not even know it because they don't feel it. Symptoms are important because they tell you that something's wrong, but symptoms by themselves don't tell you what is wrong. But the cause or the origin or the source of your dysfunction, disease, pathology, or problem, that's where you start to kind of narrow it down to what's wrong and what needs to be done. So there's a big difference between the cause and the effect, which is the symptoms, okay? So we're gonna get into some of the cause, some of the dysfunction, and how and why TMJ happens, okay? Also too, there's two different types of causes of TMJ. Acute, meaning something just happened. And typically acute means trauma, where, if you're sparring and kickboxing and whatever, and UFC fighting, you get hit, or if you're playing basketball and you get an elbow, or you're playing volleyball and you get a spike in your face and hits your jaw, that's acute. Something just happened. There's trauma related to it, okay? Or maybe you slept in a really bad position and it pushed your jaw. And you wake up the next day and you're like, oh my God, my jaw's killing me. Well, that might be acute. Typically acute is within the first 24, 48, maybe 72 hours, okay? It means something is new and abrupt that just became to your awareness. Chronic is long-term. Chronic may be your problem has been developing over a long period of time. Maybe something small has happened and it hasn't been corrected, and it gets bigger and bigger and becomes more and more of a problem. Bone spurs, those take a long time to develop, and you can have bone spurs and degeneration to the joint in the jaw, which is a more chronic problem. Or if you're doing some repetitive mechanical thing like chewing gum, or you're always sitting in a certain position where your hands, are on your jaw, or there's always some type of trauma, even chin straps for football helmets, maybe lacrosse, and your jaw is not moving, it's in a fixed position over a long period of time, clenching your teeth, grinding your teeth. It may develop over a long period of time and become chronic, and it stays with you longer. Acute problems, sometimes they can be treated and bam, you're like, wow, I feel better right away. Chronic problems typically take a long time to treat because they've taken longer to develop. Make sense? Anyways, the interesting thing about TMJ is that there's a really strong relation between the jaw, our neck, and our head. So there's a actual triangle, okay, which is maybe, I guess like this might be the best way to show it. A triangle where you can have symptoms in the jaw and symptoms in the head, headaches, and symptoms in the neck all at the same time. And it's very common to have all of these problems or symptoms happening at the same time. And we've got this big muscle here on the side of our head, temporalis muscle, that goes down and helps to control the jaw. So if you're having trouble at your temporomandibular joint, you can also have problems with how this muscle is functioning, the strength, condition, and balance of this muscle, which can relate to a headache. okay? If you have tech neck and you're on your computer all the time, or you're on your smartphone all the time, or you're in some position where you're looking down, dentists have this a lot. I even have patients that are veterinarians that are always looking down at their patients, surgeons that are always looking down during surgery. You know, they have neck problems, and because their neck is having issues and their jaw's not hanging right, it all starts to add in to headaches, jaw pain, and neck problems, okay? So as a chiropractor, I'm trained to look at all of those components and all the possible causes that interrelate and connect with each other. And that's probably one of the bigger issues when it comes to treating the TMJ disorder or TMJ syndrome, is that some healthcare providers, they only look at one component to it. And I've found this to be true as successful and helpful that oral surgeons are and dentists. They're only trained to look at the jaw and the teeth. Okay, so when they look at a patient, that's all they know is that area. Okay, medical doctors, you know, they're mainly in the profession of handling symptoms. And that's why with medical doctors, their treatment is typically, okay, we're going to give you drugs. We're going to give you pain medication to help eliminate the pain in your jaw and your head and your neck. And they're only looking at one chemical component to treating those types of issues or those types of symptoms, because drugs, for the most part, handles the symptoms, the effect. It doesn't necessarily treat the cause, okay? So in chiropractic, we're trained, and if you have special training in TMJ, which I do, and not all chiropractors do, but in our training, you know, as a chiropractor, you're trained to look at the neck and the spine, how it functions, okay? And we're trained to look at headaches. Not all of us are trained to look at the jaw, but in my case, I am trained to look at the jaw. So I look at all three. And so when I treat my patients, I treat all three rather than just one or two. So I'm trying to cast a broad enough net to pick up all the potential causes, to treat all of them at the same time, which has a higher success rate of treating just the TMJ, okay? So the other things aren't left out, and they're gone without any treatment, and those issues still exist, and it brings us back. You know what I mean? So it's like you're kind of like trying to chase your tail. Well, if you get it all into one net, you got it all at the same time, okay? And so again, you got the acute, you got the chronic, okay? And also too, the symptoms of TMJ is you might have pain, you might have popping, grinding, cracking, difficulty in opening your mouth wide, chewing food, when you yawn, maybe you can't yawn, or your jaw locking out. Okay, there's a lot of symptoms that can be related to the TMJ, and those symptoms help us in determining what the cause is, what the problem, or the origin, or the source that initially has started to happen that's caused some dysfunction here in this area, okay? So now, how to diagnose a TMJ disorder? It's actually very complex, and this is why it's important if you do have, you know, an issue with your temporomandibular joint, you want to go to somebody who's experienced in it, because they're going to know the right questions to ask you to figure out what the cause is or what the origin is. Not just how to treat your symptoms and how you feel. That's easy. Maybe you pop a pill and the pain goes away. Okay, well, that's not a long-term solution. That's a temporary solution in that the pain's gone, but the problem's still there, right? Makes sense? So something that's really important when it comes to TMJ disorders is the history, okay? And history can go as far back as childhood because, there might be accidents or injuries or events that happen that altered the structure of that joint and may have altered, okay, the function of it. But, this is actually a very sensitive area. That's why boxers are trained when they hit you, they're aiming for the jaw. Because as soon as you hit that, your equilibrium goes off and then boom, you're knocked out or TKO'd. But that is a very sensitive disc, and it's a very sensitive joint. And it's very complex in that the motion of it is so important, and it's so delicate of chewing, which of course we take into kind of for granted because we're so used to talking and chewing all the time. But there is a very proper alignment and motion and balance and coordination of this really kind of a fine joint. Also too, you've got the muscles on the side, which you could have trauma to the muscle. You can have, sometimes people get Botox injections for headaches, which that can alter how these muscles function. Okay, so the history is really, really important to get down to maybe what the origin or source originally of what happened or what's happening to aggravate the joint and cause this to be reoccurring. Okay, history is super important. The alignment, like I talked about. So you need an expert to actually evaluate how your jaw opens. Is it balanced? Is it level? Is it opening freely on both sides? Is one side restricted or both sides restricted? Very important. The motion in itself, okay, so you have alignment, which is fixed, but there's alignment during motion. How does it open? Sometimes we'll see patients where when they open their jaw, it glides from side to side, and you'll see them, get a little closer, they open and you'll see their teeth, and it's like, it goes from side to side. And that's very complex, and it takes an expert to look at that and go, ooh, okay, obviously that's not correct, but it can move in different variations that then you have to address and treat. The sound, okay, I've actually used my otoscope and auscultated the TMJ joint while people are opening and closing, so I can hear the clicking and popping and grinding. And I've also been trained where I can put my hands on the sides, and I have patients open and close their jaw, and I can feel with my hands, I can hear with my hands the clicking, cracking, popping, and grinding that they hear inside. Because it's very closely related to our auditory canal where our ears are at. And you can see, you're talking like within, a fingertip distance between the TMJ and our ear, okay? And that can be very annoying. People can get, some patients can get vertigo from TMJ problems. They can get tinnitus, where it's the ringing in the ears, okay? It can affect your hearing. And also the strength of your jaw. And, these muscles are very strong, and our bite is, one of our strongest strengths, because we need to do that to eat meat and eat certain things. But the strength of the muscles on both sides is critically important, and you need, an expert to kind of evaluate that. And our jaw can be protruded outward, side to side. So there's a lot of variations of motion that need to be evaluated to determine the strength, the coordination, the balance of the muscles, to see if they're equal and what maybe needs to be addressed. Okay. Let's see, anything else with that? X-rays. Sometimes you need X-rays. Sometimes you need an MRI. I measure the actual opening with a little metal ruler. So I'll measure the opening of the mouth when my patients first start, so I can kind of get a base study to see how much motion there is and their ability to open their mouth. Because some can barely open their mouth, but then after we do treatment, we can see an objective finding that, ooh, wow, they can open more. So that means they can chew better, they can yawn, they can do a lot of different things, and we can also measure that they're getting better and improving. Okay. Now, the last, probably, some of the most important and that people want to know about is the treatment. And there are a lot of different philosophies on the treatment. And the problem with it, I think, is that, as a chiropractor, I'm trained to look at joints for motion, okay? And joints are designed to move. Like I said, motion is life and life is motion. And the jaw is designed to move, obviously, for speaking, for eating, for drinking, doing a lot of things. And the problem with the mainstream medical approach to it is that they want to restrict motion, and they want to fix motion, because they think that by restricting it, by putting splints and guards in, is that, by restricting the motion, we're going to make it better, like putting a cast on a fractured bone. And the problem is that the joint is designed to move, and the longer it's immobile, it can cause other problems from happening, where you can get degenerative joint disease or degenerative disc disease, because the disc inside our TMJ, okay, it receives its nutrients and fluid by motion, compressing. So it kind of goes through like a vacuum effect, where by compressing and relaxing, it can suck in water content. And that disc needs water content. The hydrostatic pressure of it needs to be as much as it possibly can to act as a buffer and allow motion. But when you have a lack of motion, it can degenerate and shrink in height. And if one side is fixed more than another, now you have an imbalance that can become permanent. So fixing it and restricting motion is not good. It's very similar to a frozen shoulder. I'm not sure if any of you are familiar with the frozen shoulder, but when there's a lack of motion in the shoulder, you get fibrous adhesions and restrictions, and now you can't move it. And the only way to free up motion is you got to kind of tear it up and tear up those adhesions to loosen it up. And it takes a long, long time for recovery. So when you start fixing the jaw and not allowing it to move, it would be like, wearing a muzzle, okay? Or getting your jaw sewn together after you break your jaw. You get, when you get that stuff off, the hardware off, now it's like, oh my gosh, my restriction of motion is so much greater. Now you have a whole new problem to uncreate and fix. So the lack of motion is not good. And also too, there's therapies of injections, Botox injections, cortisone injections. And I get it that they're trying to help with the symptoms, but they're not helping the cause, the imbalance, or whatever's going on. And by doing that, and it numbs it out, or relaxes the muscle maybe more on one side than the other, now it can cause a totally new mechanical problem. And when you talk about the temporal mandibular joint, it's a mechanical problem. So, when you have a mechanical problem with your car, you take it to a mechanic. You don't change your oil, you don't change the gas, you don't change your tires, you take it to a mechanic and he works on the engine. Same concept applies here. When you have a mechanical problem with motion and alignment, you need that corrected and fixed. And you don't just handle the symptoms of it, you actually work on the origin or cause of it, and try and create the correct balance, create the correct coordination, correct the proper alignment or motion. Okay, as a tongue twister there. Okay, but that medical approach is not always effective, and that's why I get a lot of referrals from dentists and oral surgeons or people that have been dealing with TMJ for a long, long time and they haven't had any solutions, or the next step is they've been told they need surgery. And the problem with that, I don't know what the success rate of surgery is. And I know there's in some situations, people do need surgery. I've had surgery on my neck, and that's because I've had a ruptured disc, and all the chiropractic work in the world wasn't going to be able to fix that. And I had to have surgery to repair it. And in some instances, surgery is necessary, but it should be the last resort, not the first. And I've had patients that have come in with TMJ problems, and right away they were told, oh, you need surgery. And they're like, surgery? You got to be kidding me. This just started, weeks ago, months ago. Isn't there anything else I can do? Well, there's a lot. There's a lot that can be done, but surgery should always be, the last resort, not the first. And in my opinion, and people may totally disagree with it, and they're entitled to that, I do not believe that fixing the joint and restricting or suppressing motion is the answer. My opinion, it's the opposite. You need to increase the motion as much as you possibly can, unless there's instability from damage that might need to be repaired by surgery. But what I've found the key to helping restore normal motion and correcting problems with the jaw is increasing the proper motion and balance and coordination. And there's some very special ways to do that not many people do at all, which shocks me. And that's one reason why I felt it necessary to actually make this video, so people learn about these options that are out there that are incredibly successful, and they're pretty easy to do. They're not that expensive. It just takes time. It just takes effort, because the consistency and the frequency of any treatment, if it's going to be successful, frequency and consistency have to be in place. You have to do it enough to create a therapeutic momentum. One, to prove that the treatment's going to help, but to correct it, fix it, restore it back to normal. And again, this is a very complex joint with all of these muscles that are attached to our head and our jaw. We have muscles inside, our pterygoid muscles. We have the muscles on the outside, our masseter muscles, our temporal mandibular muscle. There's a lot of muscles that are help with the motion of our joint. And you can see, hopefully, let me see if I can open this up wide enough. You can see inside, you see those pterygoid muscles that are inside, I think, okay? It's kind of hard, but they're up inside of our jaw. So what I've created, and it's been very, very successful, is I treat the temporal mandibular dysfunction or syndrome just like any other joint. And I put a lot of components together in that, where I'm working on the motion, I'm working on the alignment, I'm working on balancing, the muscles and the motion and alignment in itself. And what I do is this. So I have a very special ultrasound head. It's very small, and it's designed for small joints like the temporomandibular joint. And I will apply ultrasound. Let's say, here's my ultrasound head, and I'll apply ultrasound to that disc, and the sound waves penetrate in, they collide with the disc and the surrounding tissue, and it causes vibration. So the sound waves penetrate and they start to vibrate these issues, almost like getting a little, micro massage in on the disc, but it creates heat because of the friction of the tissues kind of rubbing against each other. Well, that friction creating heat increases blood supply to the area. So one, it helps with the pain, but two, it brings nutrients into the area, brings blood supply to the area, which brings in hydration. And that in itself, I've had patients do it on the very first visit of doing the ultrasound, and they're like, oh my God, I'm cured. Maybe not cured, but your symptoms are gone. And it was all natural. It wasn't any medication, any drugs or surgery. It was just ultrasound. But what I've done is I've purchased machines that have ultrasound and electrical stimulation combined at the same time. And it's amazing to me, because I've been practicing for 33 years, not many physical therapists or chiropractors have these types of machines in their practice where they have both ultrasound and muscle stim combined together at once. So what does the electrostim do? It sedates pain, but it also treats the muscles surrounding the jaw. So you're getting like two forms of therapy at the same time. And it's small enough and safe enough where you can direct it right at that disc and right at that area, and it won't affect anything else. Doesn't hurt your hearing, doesn't hurt the jaw or the bones surrounding it, and it's incredibly effective. In the past, I'd say 3 years, I've added another therapy to it, laser, cold laser. And we use cold laser for a lot of different problems. Using ultrasound muscle stem combo and laser together, combining those two have been a game changer for me in treating my patients, where their success rates have gone way up, and it's accelerated their success and the reduce their symptoms and allowed for greater function and mobility because the pain's gone, and it's brought in nutrients in there where now it's healthier, it's healing tissues. Okay, so those two things are hugely important. And the third is I actually go in and I put a glove on and I go in and I massage the muscles. And I'm gonna tell you right now, it don't feel good. These pterygoid muscles, when you massage those pterygoid muscles, it hurts. But you want somebody who's done this many, many times, who is an expert at it, knows exactly how to do it, and feel the tissue, feel the adhesions, feel the restrictions, feel the length of the muscles to make sure they're not pushing in too much. And it hurts. And you want somebody who's experienced in that can kind of calm you down and give you some certainty, like, look, don't worry, it's only gonna be temporary. By the time we're done, you're gonna feel a lot better. So working on the muscles too, where we can lengthen them, stretch them, and massage them, because maybe it needs to be relaxed, maybe it needs to be stretched. Who knows? It depends on what the cause or the origin of the problem is. Okay, but combining those together is really, really effective. And then the last thing that I do is I actually adjust the disc and the joint, and I adjust the jaw. And that's very, very technical, and that takes a lot of experience to determine which direction to adjust the jaw. And I have a special tool that I use. There was a device created many, many years ago called the activator, and there's different variations of it now. But I have an activator gun where I actually, adjust on the jaw and the TMJ, where I'm altering the alignment, and it helps enhance motion in the proper direction. But it's dangerous to use too, because if you adjust it too much, too hard, you can alter the motion in a poor way, in a bad way, and you can also injure the disc. So you got to make sure when you see anybody that works on this, from the chiropractic standpoint or physical therapist, whoever, that they are experienced, they know what they're doing, because you don't want to permanently damage that disc, because as of right now, we don't know of any way that can regrow and or be replaced. Who knows? There might be something somewhere, but I don't know about that. Okay, so let me think. Anything else that I'm leaving out? We've got the ultrasound, we got the muscle stem, we got the adjustments, exercises. There's very specific exercises that help strengthen and condition the muscles of the jaw to make sure that it's balanced. I've got a couple of techniques that I use with toothpicks, where we stick them in your teeth, and you can do it at home where you can watch how you open and close your jaw and watch your teeth, and you watch the toothpicks moving up and down to make sure they're in a proper alignment so you can help re-educate those muscles. There's resistance techniques to strengthen and condition and balance those muscles that I've used, which has helped. But the thing is that you've got to take it all into consideration, all the aspects of it. And again, with like any type of therapy or treatment, you have to treat it consistently. You have to treat it frequently. And typically, my treatment plans are 2 to 3 visits a week for 6 to 8 weeks. And I'll tell patients, look, we're going to try this out for 6 to 8 weeks. And if after 6 to 8 weeks you're no better, then guess what? I'm going to refer you out. And you might need surgery. I don't know, but we won't know until we actually treat it and see how you respond and see if we can correct those mechanical issues that you're suffering from, which is causing your dysfunction to begin with. And I think that's pretty much about it. Hopefully I gave you a great amount of information. Hopefully this helps give you some certainty and empowers you on what the TMJ joint is, how to diagnose it, or at least a basis of how, if you see someone, they should take into consideration when they diagnose it, and then different treatment options that are out there. And I strongly suggest, like, if you haven't gone to a chiropractor for TMJ, and I know it sounds crazy for some people thinking chiropractors, they don't treat TMJ. Well, some of us do, and some of us treat it incredibly successfully. And you should try it, because if you're told that you need surgery, what do you have to lose? Permanent change that can never be altered again, or you go try therapies that are not that expensive. And also, patients do ask me, typically, how much do these cost? And across the nation, I'm kind of guessing, but my ballpark figure would be probably anywhere from $75 to $150 per visit, and some of it might be covered by insurance. In my practice, I see a lot of PPO insurance patients, and I know work comp does pay for the treatment of TMJ. So there's a lot of options out there that you can try out, and it's not that expensive in comparison to surgery, which is thousands, maybe tens of thousands of dollars, and some of it may not be covered by insurance. I don't know. I'm not an oral surgeon, so I can't comment on that 100%. But there are options out there, and I totally understand. TMJ, it sucks. It's no fun. I've had patients come in, barely can open their mouth. They've been losing weight. They can't eat. They can't enjoy life to the fullest because they can't enjoy the foods that they like. They can't talk. They can't yawn. They can't sleep. They have headaches. They have neck pain. They have a lot of different problems. And it's not fun, but there are options out there for you. We can help. I know I can. I'm Dr. Jeff Fisher. I own and operate Fisher Chiropractic of Irvine. I've been here for many, many years. I grew up in Irvine. And my people here, they're my family. If you have any questions, you can always email my office. You can comment here on our YouTube video. And if you need help and you need direction, please reach out to me. I'm here for you. I'm here to help. I just want to make you better. Okay? Thanks. Take care and good luck.